Dr. Chadwick Boseman, 43, died Friday from colon most cancers, a #1 trigger of cancer-related deaths within the U.S. and one that's more and more affecting younger Americans. While deaths from colon and rectal cancers have been declining for a long time as a consequence of improved screening and therapy measures, deaths amongst younger folks have been rising barely lately, in accordance with researchers. We are seeing extra folks of their 30s and 40s who are creating colorectal cancers, actually because they're having signs that aren't regarded as cancers, stated Dr. Nilofer Azad, an affiliate professor of oncology at Johns Hopkins Medicine. About 30% of colorectal most cancers recognized at the moment is in folks underneath the age of 55, she stated. Symptoms of colorectal most cancers embrace a change in bowel actions, rectal bleeding, blood in stool, belly ache and extra. Boseman, who made a world effect bringing Black Panther to life within the Marvel Cinematic Universe together with taking part in black icons on the silver display screen, was recognized with stage 3 colon most cancers in 2016 and battled with it because it progressed to stage 4, his household stated in an announcement Friday. Colorectal most cancers, which incorporates colon and rectal most cancers, is anticipated to trigger greater than 50,000 deaths in 2020 together with 3,640 deaths in folks youthful than 50 years. The lifetime danger of creating colorectal most cancers is about 1 in 23 for males and 1 in 25 for girls, the American Cancer Society says. This 12 months, greater than 100,000 folks shall be recognized with colon most cancers and greater than 40,000 with rectal most cancers, together with 18,000 colorectal most cancers circumstances in folks youthful than 50, the group estimates. On Chadwick Boseman, his dying provides me the braveness to maintain going. More younger individuals are being affected for youthful folks, these numbers are rising. Deaths from colorectal most cancers amongst folks youthful than age 55 have elevated 1% per 12 months from 2008 and 2017, in accordance with the American Cancer Society. In 2017, about 130 folks of their 20s died from colorectal most cancers, 720 of their 30s and a pair of 700 of their 40s, with older age teams accounting for greater and better dying tolls, in accordance with the Centers for Disease Control and Prevention. During the late 1970s and early 80s, colon most cancers diagnoses had been declining in age teams youthful than age 50 years and rising in these age 50 years and older, in accordance with a 2017 research within the Journal of the National Cancer Institute. But that development flipped within the mid-80s, when charges declined in adults age 55 years and older, whereas rising by 2.4% per 12 months in adults age 20 to 29 years and by 1% per 12 months in adults age 30 to 39 years, the research discovered. Rectal most cancers charges noticed a much more excessive model of this development. If you had been born in 1990 or afterward, you had been 2 occasions extra more likely to get colon most cancers or 4 occasions extra more likely to get rectal most cancers than these born earlier than 1990, stated Michael Sapienza, CEO of the Colorectal Cancer Alliance. It is, sadly, changing into a much bigger and larger epidemic. Sapienza, whose mom died of colon most cancers at age 56, stated oncologists are seeing extra late-stage diagnoses of colorectal cancers, which are sometimes mistaken for different sicknesses. What's taking place is, younger individuals are going into the physician having signs, and it's normally taking them to see 3 or 4 medical doctors till they're getting an analysis, he stated. Especially now, within the telemedicine world, individuals are going to be afraid to suggest a colonoscopy. If you are having rectal bleeding, nighttime sweats, cramping, particularly darkish blood, you actually to emphasize that together with your doctor. Chadwick Boseman's finest quotes, on Black Panther, James Brown and extra Baltimore Orioles outfielder Trey Mancini was recognized in March, days earlier than his 28th birthday. He was at spring coaching when a pair of blood assessments revealed low iron ranges. What he initially thought might have been an abdomen ulcer or celiac illness turned out to be stage 3 colon most cancers. Mancini had a malignant tumor eliminated every week later and started chemotherapy in April. If you're younger like me, you don't suppose you are getting colon most cancers, Mancini advised USA Today. His father was recognized with stage 2 most cancers at 58. I used to be shocked. Oncologists do not but know what's inflicting the rising variety of circumstances amongst younger folks, however there are a number of theories. We actually can't hone in on one trigger, Azad stated. There may very well be weight loss program modifications, weight problems, rising prevalence of diabetes. All of this stuff are additionally related to colorectal most cancers. High consumption of processed meat and alcohol, low ranges of bodily exercise and fiber consumption, and cigarette smoking are additionally recognized danger elements, researchers stated. It isn't a surprise that the timing of the weight problems epidemic parallels the rise in colorectal most cancers as a result of many behaviors thought to drive weight achieve, reminiscent of unhealthy dietary patterns and sedentary existence, independently improve colorectal most cancers danger, researchers stated within the 2017 research. Black Americans disproportionately affected overall, colorectal most cancers disproportionately impacts Black Americans. The most cancers incidence is about 20% greater in Black women and men in comparison with their Caucasian counterparts, and Black sufferers are about 40% extra more likely to die of colorectal most cancers, stated Rebecca Siegel, a most cancers epidemiologist and scientific director of surveillance analysis on the American Cancer Society. The mortality distinction is what's putting, Siegel stated. It's additionally the elephant within the room of systemic racism that has been occurring for many years and impacts everybody within the Black group, no matter their wealth standing. Among younger folks, the distinction within the fee of circumstances between Black and white Americans narrows, Siegel stated. White Americans underneath 50 account for a big portion of the rise in circumstances within the youthful age group, she stated. Medical bias, from 8 capsules to COVID-19, racial discrimination in well-being care festers most cancers. Baltimore Orioles Trey Mancini will seemingly miss 2020 season as a consequence of chemotherapy therapy when ought to folks get a colonoscopy? To fight the rising prevalence of colorectal most cancers amongst younger folks, researchers recommend educating clinicians and the general public about signs and screenings, and increasing well-being care entry to younger folks, who are much less more likely to have entry to a main care doctor and extra more likely to declare chapter from their most cancers therapies, Siegel stated. Researchers additionally recommend creating new methods to curb the weight problems epidemic and shift Americans towards more healthy consuming and extra lively existence. It's additionally necessary to finish the stigma around colorectal most cancers, consultants say. A quite common symptom is bleeding within the stool, and that's embarrassing. Young individuals are not accustomed to speaking about these signs with their mates, Siegel stated. Reducing the stigma and rising consciousness each of the signs and the rising danger in younger folks straight interprets to saving lives, she stated. It is likely to be robust for some folks to speak about their colon and bowel actions, however it's the third commonest most cancers and we have to speak about it extra, Mancini stated. In 2018, the American Cancer Society updated its pointers to suggest that individuals at common danger for colorectal most cancers begin common screening at age 45, or at 40 for folks with a private or household historical past of colorectal most cancers, a historical past of inflammatory bowel illness and extra. Everybody's all the time advised that you just don't want colonoscopies till you're 50 years outdated, and that's clearly not the case, Mancini stated. In hindsight, I might have gotten screened at 25 or so. More teams are planning to revisit their pointers within the subsequent 12 months or two, Azad stated. I would not be stunned if we began to see screenings transferring earlier throughout different guideline committees as nicely, Azad stated. This is a really treatable most cancers, and it's a totally preventable most cancers if folks get their screening.